I'd like to welcome Dr. Kevin Stock to my channel. He is a leading authority on nutrition as it relates to dental and metabolic health. He is a pioneer in his field and making astute observations that very few other healthcare providers are making in 2023, or even thinking about or questioning. He's not afraid to make noise about these trends, and I'm excited for what new ideas will work their way into the field of dentistry because of people like him. Kevin, can you introduce yourself and tell us a little bit about your background and what you do and what you're passionate about?
Absolutely. And thank you very much, Lindy. It's great to be here. So I am a dentist, and there's really two areas of dentistry I've focused on. And that we could even rewind further than that, because a lot of my interest in nutrition stems way back before that, because I was an overweight kid. But in the realm of like professional dentistry, I have done pediatric dentistry for the last decade. And I work for a company called Smile America Partners. They send me all around rural Missouri doing pediatric dentistry, generally in like lower income, lower socioeconomic areas where they don't have access to dentists or not good access to dentists, so like Medicaid patients. And then also the other area of dentistry is after I graduated dental school, I started a dental sleep medicine practice, which is treating sleep disordered breathing. So really what that means is treating everything that ranges from snoring to severe obstructive sleep apnea. So I was mostly treating obstructive sleep apnea with these oral devices. So those are the two niche areas of dentistry I have focused on. But like I mentioned at the beginning, nutrition has really kind of encompassed all of this for, I don't know, since I've been basically a teenager.
Wow. Okay. So that probably keeps you busy. Did you always want to get into pediatrics, or did you just stumble upon it in one of your rotations?
So the long story short is I was in dental school, and I think dentistry is a great profession, highly needed, doing good service. But it was clear to me that I didn't want to drill and fill teeth for 40 hours a week for the next 40 years. But the one area of dentistry that I actually felt like I was making a difference is treating pediatric patients that, you know, they don't really have a say over what they're eating, and they got these rotten teeth, and the kind of patient population I treat, they really don't have access to care. So it's the one area I've actually felt like I could actually make a difference. So selfishly, I got more fulfillment treating pediatric patients. And so I think that's what steered me in that direction a little bit. However, I'll say, you know, treating pediatric patients twice a week is what I started off doing. Now I'm actually down to 1 day a week. But that was enough, meaning it's exhausting. And so any pedodontists that do it day in and day out, I have mad respect for, because it's a lot of work. Kids don't like needles in the mouth. No one likes needles in the mouth. Kids especially don't like getting shots in the mouth. They don't like getting teeth taken out. And so it's a lot. So I do that part-time. Part-time has been very good. So I enjoy it very much as a part-time thing. And so, yeah, that's how I got into pediatrics.
I think that's like probably a pro tip for like a lot of people that want to go into peds. Like I did Teach for America when I was younger in New Orleans, and like loved the kids. But by the time I got home, I was done for the day.
Exhausted.
And I was like, how do teachers have kids? Like, aren't they just like wiped out? Anyway, yeah. And my peds rotations, I felt that way too. You're just like, you have to be on constantly because you're the adult in the room, right? Yeah, so I like that, starting them young and putting better ideas into their heads about nutrition at an early age, instead of like trying to change someone's behavior at like, I treat people right now who are like usually 60 years or older. So it can be hard to change those behaviors at that point.
Absolutely. I remember when I was just a kid, I must have been a teenager, but I was at the dentist, and maybe it was the hygienist was like, you have gingivitis. And, you know, I don't know, 12 years old. I had no idea what that was, but I'm like, that is a really scary word. And they're like, you need to floss every day. And I think from that day, I've flossed every single day since then. So like, to your point, like kids, you can mold them. Like if I'm taking teeth out on a kid because they have a bad diet and they got all these rotten teeth, I can say, you know, this is like a dietary issue. And if you don't want to go through like this horrible experience again, you know, we can clean up your diet. So, I mean, you can make, you know, the silver lining of bad dental health is like, all right, maybe we can change some behaviors and have lifelong benefits as a result.
Yeah, no, I love that. And we're going to get into flossing later. I have a question about that, because I think that that's like the biggest takeaway we get from like our 6-month checkup at the hygienist is like floss more, and then we're good. We're good. Okay. All right. So first question, I'd like to zoom out and address the big picture. So from your lens, what are 3 diseases or problems we are at risk for if we continue down the path of overconsumption of ultra-processed food. So what's at stake if we don't take charge of our health now? I can use my profession as an example. I typically now treat older adults. So what's at stake if they don't necessarily take my advice or really anyone's advice, treating an older adult to get stronger and build good muscle mass so that you don't fall, that you don't need to rely on caregivers, which is extremely expensive. And you don't have to rely on your kids, because most people that I treat do not want to bother their kids. That's really important to them.
Mhm.
So I really advocate strength training and eating enough protein to build strong muscle mass, and really try to frame it as this is a way to have that independence that you want. So let's hear from you.
Well, there's so many potential areas. So with regard to just oral health, is you mentioned like expenses, like, okay, so
Yeah.
you might think eating the cheap food is cheap until you have you ever gotten a dental bill? Like you'll know pretty quick, okay, that was actually pretty expensive. So you're going to pay for it on the front with healthy food and avoiding the dental bill, or you can, eat cheap ultra processed food. I should say cheaper ultra processed food. But then, we see that on the back end where you'll pay for it with, fillings and extractions and bridges and implants. And like the next thing you mentioned is like kind of like quality of life factors, where if you lose all your teeth, edentalism, it's actually way more common than people realize, like losing all your teeth. And so you get dentures. Dentures are not like having your real teeth. First of all, nothing is like having your real teeth. So even like implants, which is kind of the gold standard of replacing a tooth, that's not the same as having your natural tooth. And dentures very much so are not like having real teeth, especially bottom dentures.
And I imagine those are
expensive, and every time you go to eat, it's like a challenge. And so, I mean, there's quality of life factors. Also, like if we're just looking at oral health, one thing I talk a lot about is because it directly relates oral health and metabolic issues. And I coined this term called fatty tongue, and it's not a real thing, but it's basically as we gain weight, especially as we get obese, the body's going to put fat wherever it can. And the tongue is one of those places. And our mouths are already too small. That's an issue we can also talk about. But we have these shrinking mouths, ancestrally, evolutionary speaking. Our mouths are getting smaller and smaller. But the tongue is getting bigger and bigger. And we have an airway back here that can start getting obstructed because of those dynamics. Obstructive sleep apnea is what I would treat. And so one of the core issues here is if you're eating a poor diet, you're gaining weight, you're getting a fatty tongue. We have a small airway already. Now it's getting smaller because of a fatty tongue. You get obstructed breathing when you sleep. And obstructive sleep apnea, also one of the areas I liked about treating sleep apnea is similar to pediatric dentistry, is there is a fulfillment factor to it. What I mean by this is someone that has obstructive sleep apnea, they often go 5 to 10 years of having disrupted breathing while they sleep for nearly a decade often. And so once you treat them, they open their airway, they get like the first real night of sleep in a decade, and they feel like a new person. They're like, they didn't realize how tired they felt, how low their quality of life was because they're always tired. And that affects everything. If you're not sleeping throughout the night, like almost all my patients, like a huge percentage are on antidepressants. And if you haven't slept for a decade, I think almost everyone would want to be on antidepressants at that point, but it makes a huge change in quality of life. So, I mean, that's one thing. Like if you don't take care of your diet, which we can see in the mouth as a fatty tongue and a small airway, you suffer the consequences of obstructive sleep apnea, which will impact your entire life in a negative way and your health in a negative way as well.
Absolutely. Even like your long-term health, because we know how important sleep is for preventing things like dementia, Alzheimer's. No one wants that. Talk about expensive quality of life.
If you look at the numbers that relate basically obstructive sleep apnea and how it exacerbates the various comorbidities, everything like you mentioned, heart disease, Alzheimer's disease, it makes everything exponentially worse. So yeah, getting sleep and making sure you don't have an obstructed airway when you sleep is critically important.
That's really great. And good to hear. I've never heard sleep apnea described that way. And actually the next coming weeks, I'm talking to a physician who runs a sleep apnea clinic in my hometown. So this will be really good to bring in your perspective, to have him speak on that as well. Thank you. Anything else at risk if we don't do anything about our diet now? So you talked about sleep apnea, the cost of dental repair. What's another big one you can think of?
A big one is actually, it seems like a minor thing, but it is a major thing for people that have it. And that is, and the lower socioeconomic class, especially, you lose teeth. They're like, okay, so you go to the dentist, they pull a tooth out. Maybe you get that, so you can afford that amount, but you can't afford to get implants. Well, there's a huge social stigma. If you're trying to go get a job and you're missing front teeth,
Totally.
there's a massive
Yeah.
social issue there. And then there's self-conscious issue of how you look. People are afraid to smile because they're missing teeth. That is a deep rabbit hole. There's a really good book written by Mary Otto on that dives into this social issue of poor oral health and
Yeah.
missing teeth and things like that. So it's actually a very big cost associated with that as well. So
Absolutely. That sounds like a terrible domino effect. And I feel for those people. And I've worked with those people, and you're right. They like don't want to leave the house, and it's a snowball effect of so many other problems that they don't want.
yep.
Okay. All right. So I recently heard a quote from you. It was an intro to one of your keynote speeches. And you said, the mouth is the canary in the coal mine. It is telling us what to eat. So tell us, Dr. Stock, from your lens, what should we be eating? Humans.
Yes, and I think I say that a lot because I think it's such an important concept, especially for dentists to realize. And really, it's kind of the dental field and medical fields were more bridged in the past, and they've kind of rifted quite a bit. And the problem is often problems will first manifest themselves in the mouth before. So I'll see a cavity perhaps 50 years before that is diabetes, for example, diagnosed diabetes, and periodontal disease likewise. Like these are all very closely associated, but the serious end consequences are usually decades down the road, but dentists can spot the early warning signs early in the mouth. And so that's why I think it's very important. That's why I say the mouth is the canary in the coal mine. It's the early warning system that is telling us often when our diet is off. Because if you get a cavity, although we've normalized cavities today because over 90% of people have a cavity, it's the most common disease in the world. So we've normalized it. It's just not part of life is getting cavities, which is not true. If the hardest substance in your body is decaying, it means something is off. And so it's not a normal, natural thing, even though it's common, it's not like normal.
Mouth is rotting. Everything's all right.
Yeah, exactly. I often like to try and like tie like analogies to this. Like if you could imagine the bacteria eating holes through like your humerus in your arm, you'd be like, oh, this is a big problem. Like we got to, whatever I'm eating that's causing this, I better do something about this. And so, yes, I think the mouth gives us many clues about what we should be eating. And I think how we develop cavities is very telling as just one example. For example, we get cavities when we eat when we eat carbohydrates. There's bacteria in our mouth that ferment those carbohydrates into acids, and those acids eat holes in our teeth. And proteins aren't going to cause cavities. Fats aren't going to cause cavities. One macronutrient, it's a non-essential one, carbohydrates, are the ones that are going to cause cavities. And if they're refined, it especially makes it even more likely to cause cavities because there's more surface area for the bacteria to ferment into acids. But to me, it's like hey, this is a red flag. Maybe you should not be eating so much of this certain macronutrient that is non-essential that causes bacteria in your mouth to eat holes in the hardest substance in your body. So that's one example of the mouth telling you, hey, maybe eating a very high carbohydrate diet is not a great idea. Unless someone thinks that, I like to think like if someone thinks, okay, a diet that is bad for your mouth is good for your general health, like that would be the argument they'd have to make. And to me, that argument that doesn't pass the common sense test. Like so people that argue for high carb diets, that's essentially what they're saying. We know that's not good for your oral health, but it's good for your general systemic health. And like to me, that doesn't make any sense. But essentially that's what people are arguing. So that's one thing that I think the mouth tells us. Perhaps humans were designed to eat a lower carbohydrate diet and especially avoid these refined carbohydrates because those are known to really exacerbate caries risk, which caries is cavity risk.
Caries is cavities. Just so for some of our viewers, we have all kinds here. When you say refined carbohydrate, can you give an example of refined versus unrefined? Or I can,
Sure.
if it's helpful.
Sure. There's a most, I like to use corn as an example, because if we say corn, someone will think of corn on the cob, but most of the corn we eat is
Sure.
not corn on the cob. It's corn starch. It is high fructose corn syrup. And so corn is in so many of our daily products. Like if you just go to the grocery store and just start looking at labels, you realize corn is in everything. And if you see corn and it's not on the cob and it's in something else, it's an example of a processing of a whole food plant into a more refined version of it. And
Okay.
so eating
So
corn on the cob is not the same as high fructose corn syrup that's in a soda.
Sure. Or like a sweet potato versus like a sweet potato chip made by Lay's or something like that, right?
Yep.
Not the same thing. Okay. All right. So we're going to touch on protein and meat a little later. But next question. So we've all been told at the dentist to brush more, floss less, which is kind of akin to exercise more, eat less when a healthcare provider is counseling someone on weight loss. And then, of course, to stay away from sugary drinks or acidic foods. We've all heard this from our hygienist or a dentist. This is the only advice you give to your patients for optimal oral health. And in your opinion, what's missing from the typical dentist or hygienist spiel at the dentist's office?
Yeah. So a general dentist that you go to, first of all, as a dentist, we are required to give nutritional counseling. And I don't think most dentists probably do that, or especially don't do it adequately. Maybe they'll give it lip service,
Sure.
like you mentioned, let's limit sugar. Usually it stops at that. If they're a little bit better, they will say limit sugar and snacking. And what they mean by that is carbohydrate snacking, but almost all snacks are carbohydrate, at least have carbohydrates in them.
Yeah.
And
I'm
so
I'm getting old and I've never heard a dentist tell me to limit snacking or carbs. Like, so maybe I don't have a great dentist, but I wish that was something they talked about more.
well, almost no dentist is going to recommend limiting carbohydrates. They'll say limit sugar and limit snacking. And so here's the classic rundown. You go to the dentist, they're going to tell you brush twice a day in the morning and in the evening, floss at least once a day. They're going to recommend fluoride toothpaste, perhaps a mouthwash. I mentioned flossing at least once a day. They're going to recommend, from a dietary perspective, limit sugar and limit snacking. Like I said, some will go that far. Now, the issue with snacking is, I'll go ahead and explain it for like the listeners, is when you eat carbohydrates, we went through it, bacteria ferment it, create acid. Now, you now have this acid environment in your mouth, and it takes a certain amount of time for the body to increase the pH back to baseline, so that we don't have, to get back to the normal pH of the mouth. Each time you have a snack is like you drop the pH of the mouth, and then it'll go back up and then it goes back down. So if you eat 3 meals a day, you have, let's say, 3 bad meals a day, you have 3 acid attacks in the mouth. But if you eat 3 meals a day and then you snack in between meals, you could have 6, 7 acid attacks a day. And what's the worst thing you can do for your teeth is drinking these sugar drinks, because what people tend to do is they will sip on them throughout the day. And so you're getting acid attacks all day long. These drinks are already acidic, usually, like they have citric acid, they have malic acid. They're already acidic, phosphoric acid. They have sugar, and that sugar is then fermented into more acid. And you're not chewing, and chewing stimulates saliva, which acts as a buffer for this acid. So that in a nutshell, that is why drinking like sugar drinks is the worst thing for your oral health, but it also tells you a lot about diet in general. Like snacking isn't the best thing. Sugar's not the best thing. Carbohydrates are what cause cavities. So we can glean a lot from that.
Wow. I've never heard a dentist speak about snacking. I love your Twitter account. I think this would be a really good thread, because I don't think I've heard you talk about snacking that way as it relates to acid and dental caries and cavities. Like, that's huge. And that is like a message that you could simplify for a kid in your practice, right? And I wish when I was a kid, my dentist would have like laid that out. Like, here's why we don't do it, instead of just like, don't snack, don't eat candy, like we need to know the why. And kids can handle it. Adults can handle it too. Like, we need to be telling people the why. Otherwise, it's super, super hard to change behavior. Okay, that's really interesting. Thank you for that. So not only is snacking not great for our overall metabolic health, it's not great for the mouth.
Yeah.
I'm hearing. Okay.
If it's carbohydrates. If you're snacking on fat, which is very rare, I mean, but people then it's going to be totally fine for your oral health.
That's the
But it's
caveat. So we can have like fats as snacks if we need it. But if you're eating enough protein at each meal, like there's really no need for snacking. And you
that's
and
the
I,
next point. Yeah, if you're not going to need, most people that are eating good amounts of protein and enough fat, they're not the ones needing to snack all day long.
Right.
So it's just another clue of what your mouth is, a clue that the mouth gives you about how we should eat. Oh, maybe we shouldn't be eating 5 meals a day. Maybe we shouldn't be eating so much carbohydrate.
Yeah. And like a note on snagging, I'm not sure if you noticed this, but like the days I'm busy, I treat patients all day. The days I am wanting a snack, I almost always know, okay, Lindy, you did not have enough protein at breakfast or lunch. Like, get your act together. like you don't need this. Like, and it's my fault. Like, right, I did not eat enough protein or fat to satiate me, and we want a snack. All right, next question. So, hot topic is mouthwash in the health and wellness space right now. So, for those in the audience that might not have heard about the link between blood pressure and mouthwash, or mouthwash and the oral microbiome as it relates to our overall health, can you bring us up to speed? Is minty fresh breath really worth it? Or are there other ways to use a mouthwash if you're using it to freshen your breath? What are your recommendations on this?
Perfect segue, because I was talking about, when we talk about cavities, we talk about quote unquote bad bacteria that are fermenting these carbohydrates into acids and causing cavities. However, a lot of people, dentists even, will just go and think like bacteria in your mouth is bad. Let's take antibacterial mouthwashes. Let's kill all the bacteria out so that they cannot ferment these carbohydrates into acid and give you cavities.
Right.
The problem is the oral microbiome is very important for many functions. And the one that you're alluding to, importantly, is nitric oxide production, which 25% of all our systemic nitric oxide is going to be produced in the mouth by these oral bacteria. So if you're nuking it with antibacterial mouthwash, you are nuking 25% of your systemic nitric oxide production. And nitric oxide is a super important molecule for vascular health. It plays a critical role in vasodilation and thus regulating blood pressure. And so I am very much against antibacterial mouthwashes and trying to just nuke the oral microbiome in general, I think is a bad idea. Like, we don't take antibiotics to nuke our gut biome. Most people would think that's crazy, right? Well, the oral biota is just, this is one tube here. The oral biota basically leads, and some people think seeds, the gut biome. So we don't want to just be nuking it with antibacterial mouthwashes. And so that's the link there. Now, what can you do instead? Is that?
Yeah. What are the alternatives for people who are like, this dentist is crazy. I'm going to continue using mouthwash because the ADA recommended it. So they must be right.
So the question is like, why is someone using mouthwash? Is it because someone told you to and you're trying to prevent decay? Well, that's really a dietary issue. And I would address that over trying to take an antibacterial mouthwash. If it's for bad breath, halitosis, that is often, I would get to the root cause of that, because if you're having a proper diet, which is going to lead, halitosis is generally most commonly dysbiosis of your biota in your mouth. And commonly that is a resultant of two things: poor diet, mouth breathing. And so I'd get to the underlying cause of what's causing that bad breath. And so generally, if you're eating a proper diet and healthy, you should, there's like a neutral, I would say neutral breath. Like, it's not bad, repulsive, but it's not like minty fresh. But if you want minty fresh breath, there's some things. I don't do anything personally. I don't even recommend anything personally, but you can use there's like some DIY essential, like peppermint oils you can use, things like that, which are more or less all right.
Yeah. And you don't have to recommend that. I mean, sometimes patients are like, give me a recommendation on this. I'm like, I can't, because I don't recommend it.
Yeah, there's nothing. I'm like, I'm not a big supporter of anything. Yeah, there's no like mouthwash brand I'm like, get that. But there's definitely some that are like better than others. Meaning, if you look in the ingredients, usually there's the fewer ingredients, the better. But usually a lot of these mouthwashes, they got all kinds of stuff in them. Antibacterial being one of the functions of those ingredients. So I would avoid those.
Yeah, I got to thank Max Lugavere for shedding some light on this topic. And I think he even talked about it when he was on Joe Rogan's podcast. For those of you who don't know Max Lugavere, he is the person behind the Genius Life podcast. It's amazing. I have no doubt that you are going to be a guest on this show soon. So do you follow Max?
We've had a little bit of banter on Twitter, but yeah, so
Yeah, you'd be such a great guest on his show. I can see it in the next year. Okay, next question. So kind of on similar topic to mouthwash. What is your stance on fluoride? And is there a more effective way to prevent cavities or dental caries, as you say? I was just at the dentist last week and she was really pushing me for fluoride. And I told her, like, okay, I'm not so sure, like, here's why. And she was very respectful. But I still felt like a little bit like, oh, like I'm disappointing her. So talk to us about it.
Yeah, I don't think you're disappointing her. And there is incentives for dentist hygienists to push these fluoride varnishes because they make money. Takes 2 seconds to apply. They make money. Insurance covers it. Sometimes that's a caveat. So a lot of times people are paying for this out of pocket as well. Wow. And according to the ADA, it's like, hey, this is not going to cause any harm. It's all good. So like all incentives are like, get fluoride. Fluoride is a big topic. I wrote an article not long ago diving into the history of fluoride and my general thoughts on it, because it can be a little bit of a nuanced topic, meaning it's different if you're an adult using a small amount of fluoride that's pharmaceutical grade toothpaste and spitting it out and not swallowing it, which I don't really recommend that either. But that is a very different situation than a young child drinking fluoridated water day in and day out throughout their entire development. So we're talking about fluoride in both these contexts, but they're very different contexts, meaning an adult that's already fully grown using small amounts of fluoride, spitting it out because they're old enough not to swallow it, XYZ. I don't recommend that, but that's not nearly the same story as the fluoridated water infant drinking lots like water throughout their childhood, because the research around the potential for fluoride to negatively impact brain development is compelling, like on par with lead. And so to me, that is just like the risk reward ratio, which I think is the important thing to look at. Everything has potential, like, hey, this is the potential benefit, but this is the risk of this treatment. The risk reward for fluoride in young children is astronomically skewed towards risk, in my opinion. Like, right. Maybe it will help prevent a single surface cavity. Like, that's kind of what the research shows, maybe. And I could fix a single surface cavity in like a minute, no, maybe 5 minutes. Okay. Anyways, it's not a huge deal, but I can't fix a drop of 5 IQ points, which is going to affect them negatively for the rest of their life. And right. So the risk reward there is horribly skewed. For adults looking for like a remineralization, that's fluoride's role. Like, basically we're getting the demineralization of our teeth and we want to remineralize it. And fluoride acts as a remineralization agent to strengthen the teeth. Well, we can also use hydroxyapatite, which is what I would recommend over fluoride. Now,
where can one find that?
Yeah, sure. There's toothpaste with it. Risewell, okay. Risewell is a brand. Boca is a brand.
I just bought Boca because of you. It's coming in my.
Well, that's a good option. Now, here's the thing. There tends to be 2 camps. Traditional dentists are going to like fluoride, 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 fluoride. I'll call it, what do you call holistic dentist, biologic dentist, whoever's in the other camp. There's okay. Hydroxyapatite, 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 and they're recommending nano hydroxyapatite. I am more on this side, but I'm not fully over there where I'm like a hard proponent of hydroxyapatite. And the reason being is there's 2 forms. There's more than 2 forms, but we'll just simplify 2 forms of hydroxyapatite, like nano and regular, we'll call it. I am hesitant. I think there's potential downsides of nano hydroxyapatite. And maybe I'm just overly cautious because I've seen too many of like, chemicals come in to do some good. And we find out 50 years later, oh man, that's cytotoxic, right? Nanoparticles are very small, so potentially cytotoxic. So there's nano hydroxyapatite. The reason people use that is because these small particles are better at remineralizing the teeth than the macro nano or hydroxyapatite. And so the regular hydroxyapatite is just not as effective. And so I am like, oh, do you recommend the not as effective remineralization or the more effective one that has more potential downsides versus the fluoride? I recommend hydroxyapatite. Nano or macro is going to be better than fluoride, in my opinion, or safer, I should say. But I don't have a firm stance on this yet, meaning hydroxyapatite, which there's a lot of people on that side of the fence. I think a proper diet and really these remineralization agents become superfluous. And
Yeah,
so,
that was kind of like my follow-up question. Like, if you're eating like a proper diet, does this even matter?
yeah.
And I think like back to like giving kids fluoride, like I don't think we're seeing cavities because of a fluoride deficiency.
It's not a
Right?
fluoride
Like the
deficiency.
same to me with, we can all think about what we want about Ozempic. I'm sure there's great cases for it, but like we're not seeing obesity because of a deficiency in Ozempic, right?
Right,
We're not gonna put
exactly.
Ozempic in the water. Like maybe we should, if we're putting something in the water, maybe we should like take a few steps back and being like, why are we seeing this problem?
Right. And that's why so like 98% of Europe has banned fluoridated water. And the
Oh,
reason why
interesting.
is the only reason we put fluoride in the water is to prevent dental cavities, which is a disease. And so by definition, it is a form of mass medication. And so these European countries have rejected it as a form of mass medication, because as you mentioned, fluoride is not an essential mineral that we need to be getting in the diet. And so
Yeah.
unlike iodine, which has been added to a lot of salts,
Mhm.
fluoride is literally only, it's not an essential mineral, only added to water supplies to treat a medical condition. And so, yeah, it's United States drinks more fluoridated water than I'm pretty sure the rest of the world combined.
So will like a typical filter, like a Brita filter or something like that, or a filter on your fridge, will it get rid of fluoride, or do you have to take extra steps?
Yeah, you have to take extra steps, unfortunately. So there are kinds of filters that will filter out fluoride. So I have a Berkey filter. I filter fluoride out of my water. There's other ones that are less expensive than Berkey filters. I have to double check the names of. There's a bunch of brands actually, so you can get your hands on them. I fluoridate. I mean, I take it out of my water. I really recommend parents of young children to take it out of the water.
Yeah. And I can
Whether
see that.
adults drink it, I'm.
Yeah, you care less about that, right? I can see that being a big hurdle though for like young families, especially in this terrible economy. Like that is just like another expense that probably most people can't afford. So that's,
Mhm.
I hope we take it out. All right, next question. So on the topic of kids, this one's for the parents out there. So as babies transition into solids, what is your advice to parents as it relates to jaw development, oral health, and setting the stage for just good metabolic health? Movements like Solid Starts on Instagram, which promotes introducing solid food to babies instead of like the Gerber pureed food or even homemade pureed food, is gaining in popularity. Are we finally steering the ship in the right direction with movements like this? And in the simplest of descriptions, like what should we be feeding our babies as they wean from their mom?
Like all the topics, this is a huge topic. So I will try and keep it simple. I posted on literally this topic this morning and pushed back generally from it. Because
I'm
it's
sure.
as gently as that you try and say something, for example, because breastfeeding plays a very important role in infant nutrition and craniofacial development. And so what we're talking about, fully growing our faces to their genetic potential, breastfeeding plays an important role in it. And so pointing that out, but then many mothers feel like shame because not everyone can breastfeed. And so society has like made them feel shame, I think. And then like this post, I think, made, not intentionally, but some people feel shame. It's like, hey, you're saying
Yeah.
I'm a bad mother because I could not breastfeed my child, which is of course not what I'm saying.
I
Everyone
get
does
it.
the
I've
best they
been
can.
almost canceled on Twitter for talking about formula before. So I get it. And that's not our intention, right? We're just talking about a topic, but understanding not everybody can do this.
But it's important because it's an important topic to discuss, because the food industry has done all they could to say, hey, bottle feeding formula is as good, if not better, than breastfeeding and breast milk, which is like, couldn't be further from the truth. And so I think it is important to at least so people are educated so they can be empowered to make the decisions the best that they can. So, and I kind of relate it to, I talk about eating red meat all the time. And it's not because I want to shame people that cannot afford eating a lot of red meat, because there's a lot of people out there that, like you said, it's economically tough feeding our family of 8 with red meat that's just beyond our means. And it's not like trying to be shamed, but I think it's still important to empower these people to be like, hey, this is what, I believe is a healthy diet, and you're doing the best you can. Like, you can't do the best you can unless you know. And so I think these are important discussions. But to get to the topic, so infants, babies, young children have immense growth demands, but they eat small amounts of food. And so it's important to make every bite count. And the way we can make every bite count is breastfeeding is one way to really optimize nutrition early on for an infant. But as we wean, and you mentioned baby-led weaning, which I think is super important, we wean onto solid foods. This is the idea of baby-led weaning, where usually around 6 months, the baby can sit up with more or less without tons of support. They've lost the gag reflex. They have an interest in food. They can start grabbing food, and you start introducing solid foods. And I think introducing red meat at this time is one of the best things you can do. You give them a bone, they can grab on it, start gnawing on the bone. You can cut up tender pieces of steak into small pieces. They start eating finger food. This is instead of slurping baby food mush off a spoon. And this has serious consequences. And the evidence to me is quite robust, although no one believes this yet. And you can just go to the post today. Like, people are like, this is only genetics. Like, your facial development is only genetics. Malocclusion is only genetics, which the evidence suggests it is not. I'm fascinated by dental anthropology and archaeology because of this, because we can go back in the fossil record and we can look and we're like, there wasn't malocclusion prior to really the Industrial Revolution, and really it wasn't cavities prior to the Agricultural Revolution. So anyways, I find it fascinating that the genetic argument just doesn't carry much weight. Now, there's absolutely probably an epigenetic component to it. That's a whole rabbit hole we could go down. But in short, I think because these young children have immense growth demands, they do need to make every bite count because they can't eat lots of food. And introducing the most nutrient dense foods makes all the sense in the world. And so we're going to go look and see, what are these most nutrient dense foods? It is red meat. Give them some beef liver. That's a super nutrient, right? And you do this in tandem with breastfeeding, with baby-led weaning, until the baby can eat all on its own.
Okay, so like literally giving like a baby like a rib, and you can like get the meat off the bone.
They can chew on it. And
teething toy.
yeah, at that time when you give them a bone, it's not so much about them trying to get tons of nutrition eating off the bone. That is developing all other kinds of habits and chewing and dexterity and all the kind of benefits that go with. It's kind of the opposite of the downfalls that come with slurping off being fed, slurping off a spoon. So getting the independence and things like that.
Yeah, I was actually just in Austin last weekend with friends who are really into the baby-led weaning, and they were telling me how they did it with their son. And she kind of described it as like, we would give him like a rib. And it wasn't like he was getting all the meat off of it, but he was like exploring his mouth. It was really sensory. It was like, okay, this is what we do to not choke. Like, this is my mouth. I've never really felt it before. So I thought that was really cool. And I'm really new to this, but very interested. I've tweeted before about, and you've probably made this observation and maybe tweeted about it too. Just like, are we the only culture that does like a kids menu? Like, what are we doing? Like, every other country I've been to, like, or just eating what mom and dad or aunt and uncle are eating. Like, why are we doing this here?
That's such a great point.
Mind. And it'd be more affordable. Like, you wouldn't even have to order for your kids. Just like order for mom and dad, let them eat off your plate.
And what's interesting is when you say kids meal versus like an adult meal, to me, nutrition is even more important for children. They have all these growth demands. Like, so kids meals tend to be less nutritious than adult meals, right? It's like, hey, let's just have the fries and the soda. It's okay to have lots of sugar as a kid, right? Oh, but as you're an adult, oh, I've outgrown the whatever, the sugar candy. Not most people actually haven't, but I think we associate like, it's okay, it's kid food. It's okay they have junk food because they're just kids. And to me, it should be the exact opposite. Like, we need to very much stress good nutrition early on. And so the kids menu should be full of the most nutrient rich foods. And then if you're an adult and you want to eat junk, you're smart enough. I mean, you can get educated to know if that's a good or bad decision. But these kids, they don't know, like I've said. So it's like, I actually think it should be flip-flopped. Like, maybe we have a kids menu, like all the most nutrient rich foods on the kids menu. We get rid of all the toxicity and the sugars and in the kids menu. And those should only be for adults, kind of like alcohol. Like, you're not feeding alcohol is not on the kids menu, right? So maybe we should treat these other junk foods more similar to that.
Yeah. And I'm like really trying to think, like, why did it start? Maybe people really were like, okay, like if you cut up a grilled cheese, little one's not going to choke. But back to like solid starts, like the whole goal is to introduce real food right away.
Hmm.
So perhaps this movement will really make us think twice about, you know, stuff like this at restaurants or even at home. And I think even like, I don't have kids, so I have to be careful saying this, but sometimes I wonder with like picky eating, is it because these other options exist? Like, sure, if I'm 4, I probably do want like chicken nuggets and grilled cheese and ketchup and like sweet and sour sauce over what my parents are eating, if that's offered to me, because it's hyper palatable, it's tasty, and it all makes sense.
So like you, I also don't have kids, but I'm around kids all the time. From doing pediatric dentistry to my brother just had a 6th kid, I'm around
Yeah.
kids all the time. And as just an outside observer, like not even from looking at like the sugar risk on oral health and cavities and all that stuff, what I see is these snacks become all encompassing. All kids talk about, when's the next snack? Can I have this? All dinners are about fighting over, I don't want to eat that. I just want the cake and the dessert and the ice cream, or only the fruit and the sugar. Like it becomes the conversation, like the conversation is around junk food.
Right.
And to me, I'm like, this can't be normal, right? And people are like, oh, you just don't have kids. Like if they were all begging you for sugar, that's what you give them. So maybe they have a point. I don't have kids, but I don't think the behavior is normal. And I think it's probably one of the parents' biggest struggles is eating, because we have all these sugar junk foods that are akin to like drugs to these kids. Like they are just like drug seeking, and you're trying to give them a healthy food first, and they're like, nah, I don't want that. And so maybe these kid menus kind of stem out of just giving in to the child pressure, being like, I am not eating that stuff, I only want the junk.
Right.
And so
Yeah.
I think from a parenting standpoint, like if I have kids, there's going to be some strict rules around sugar, like not having it in the house, because I think it just ruins meals and family dynamics, and just always fighting about when's the next snack and can I eat this, and no, you're yelling, you can't eat anything until you eat this first. Like it's what all the battles are about.
Yeah, it looks really hard. And I commend parents in this day and age when that stuff is just all over the place. And like, I think that you can do your best to control what happens at home, but as soon as the kid goes to a birthday party or really anywhere else in the world, they're going to want to participate with, I mean, we're
Hmm.
social animals. They're going to want to participate with
Yep.
their peers and feel, the same as everybody else. So it looks really hard.
Maybe it's
It's
something where it's like that's seen as, hey, that's a special occasion,
yeah,
not 3 times a day you can eat this sugar snack, and then after meals you get desserts. But like I think kids are smart enough. I don't think we give kids credit enough often that they are smarter than we give them credit for. Is that, hey, that's something we do once a month at a birthday party where you can eat something like that. But we're not talking about it every day, in between meals, every meal, after each meal, when's the next thing. So I think it's possible, but people are
yeah,
like, just wait till you have kids, and then you're just
yeah. And then maybe they're right.
right. Give them the junk food, get out of my hair.
I don't know. Time will tell. All right. So, kind of wrapping up, last question. We covered a lot of ground here. This has been really amazing. I hope our listeners appreciate it. I've learned a lot here. What are 3 actionable steps someone can take today to implement what you just described to us to improve their oral health and then just their overall health? Because it's not just about like our mouth, setting us up for like good health.
Yeah, I think the traditional advice here would be like, hey, what are the 3 things I could do to improve my oral health? And they'd be like brush, floss, and don't snack, or limit sugar. Those are probably the 3 that you would get. But I would I would change mine, just 3 dietary things. I would say reduce carbohydrates. I think humans, like we talk about a species appropriate diet. I
Yeah.
think Homo sapiens, like we are designed to eat, like biologically, to eat low carb, no carb. Like high carb diets, I think, are inconsistent with human physiology, and lead to adverse health outcomes. So I would recommend low carbohydrate diet. Now that's easy to do from an oral health perspective, because cavities are the most common disease in the world. you're not going to get cavities if you're not eating carbohydrates. Carbohydrates literally cause cavities. So I would reduce carbohydrates, low carb diet. One thing we didn't get into, which is understandable because it is a massive rabbit hole, is fats are not created equal. And I've done some deep research into like fats and obesity. And to me, it seems pretty clear that these vegetable oils, specifically vegetable seed oils and excess linoleic acid, is contributing perhaps more than anything to the rise of obesity. And so from an oral health perspective, that's important because that obesity is seen in the mouth and your tongue and a narrowing airway and obstructive sleep apnea. So I would say fats are not good or bad. It's the kind of fat. Animal fats, specifically ruminant fat, is what I would recommend most people, and I recommend most people steer away from most vegetable fats, especially vegetable
seed oils.
Especially seed oils.
Okay.
So low carb, no seed oils, and a third dietary thing. I would say not dietary. I would say nasal breathing at rest. Like I can just see you right now, your mouth is shut at rest. Tongue's probably on your palate. That's what you should be. You have that's good oral posture. You're breathing through your nose, very important. And that'll play a huge role in oral health, but also overall health. So those would be my 3 things.
I love that. Well, thank you so much. This has been amazing, and what an honor to talk to you and share your knowledge with my listeners. So where can people find you? I mean, I have found you on Twitter, which I really love your tweets, and I think you're sharing some amazing knowledge that most people aren't getting anywhere else. But besides Twitter, like, where can people find you? Where are you producing your content?
Well, thank you for having me on. It's been an honor being on, and I've been looking forward to talking. I know we've gone back and forth on Twitter, and I enjoy following you on Twitter. So I am actually a writer first, like a research kind of writer first. And so that's why I like Twitter, but I'm on all the other social media platforms. But what I would recommend to people that they're interested in this is you can go to Twitter, and I have the link in the bio to this latest presentation I gave that goes more in depth on these concepts and with good visuals. So I think, especially the airway stuff, which we touched on here a little bit with sleep apnea, but the craniofacial development and how that craniofacial development and obesity and how that leads to airway problems, I think is super important, not talked about enough. And so I would direct people there.
Yeah, I'll link that in the description for this video. And then you also wrote some other things that you mentioned during our talk today. So I'll link those as well. But it's been great to have you. Thank you so much. And I look forward to like the next time we talk.
Well, thank you for having me on. I'm looking forward to connecting in the future and staying in touch.